My name is Abigail Jackson, and today I'm going to be talking about cardiovascular disease in relation to omega-3 fatty acids. I'm going to be talking about the risk factors, prevention, treatment, and what the main causes and issues are with cardiovascular disease. Okay, so first off, cardiovascular disease has a couple of causes. In particular, cardiovascular disease is caused by unhealthy eating and diet, but it's mainly caused by the narrowing of arteries due to plaque buildup, pressure within the blood vessels, and also it can be caused for drug using, smokers, people with diabetes, basically living an unhealthy and unbalanced lifestyle. So who is affected? So in particular, men and women both have the same rate of being affected by cardiovascular disease and heart disease. Predominantly, women over the age of 40 and men over the age of 50. Like I mentioned earlier, smokers and diabetics also have an increased risk in developing this disease. So there are a bunch of risk factors, but I'm just going to name a few. In particular, age, like I stated earlier, about the 40 to 50 range is when cardiovascular disease becomes aware or present in one's body. And there are some cases that have been a lower age bracket, but it's mainly the 40 to 50 range. Also, obesity. People that are obese or have a large BMI number are at great risk of developing this disease. And you really have to take a look at family history as well. So genetic predispositions and family history, if the grandfather or father or mother has had cardiovascular disease or heart-related issues, there could be a genetic predisposition. Diet plays a huge role. People who eat high-fat diets and high-sodium diets have an increased risk, along with people who live a sedentary lifestyle and don't include a lot of exercise during their regular daily activities. It's recommended to do about 30 minutes of exercise per day or more. So next, we're going to talk about the symptoms. So there's a variety of symptoms, but first, chest pain is one of the most common symptoms. A lot of people will notice a heart-related issue if they feel pain in their chest. They also might feel shortness of breath as well, and they can find pain in their arms and in their legs, and in some cases, their throat or their neck as well. You may also have dizziness, fatigue, or fainting can be another symptom. Okay, so the diagnosis. So in order to diagnose this disease, you have to speak to a doctor or physician. So you want to have a physical checkup. From there, the doctor will test your blood and will go through a series of x-ray exams to see if the disease is present. And if it is, there is an EEG test they can do. It basically is electrical waves that show your heart rhythm. And if it's more serious, you can also do a CT scan. A CT scan sends signals and it gives the doctors an image of your heart and your lungs. And then there's an MRI. MRI is similar. It's a donut-shaped tube with a bed, but it sends magnetic signals instead of electrical waves. Okay, so for treatment. So there's a various amount of treatments. Number one, lifestyle change. Lifestyle change is the main focus when preventing or treatment. You really want to start living a balanced lifestyles and making healthier food choices. Medications is also another way, and I'll be talking about omega-3 fatty acids in the next couple of slides and how that helps. Then we have diet, we have exercise, more than 30 minutes a day. There's also yoga, meditation, and various other options that will help as well. So, after treatment, omega-3 fatty acids. So this is what the basis of my lecture is on and how omega-3 fatty acids will help with heart disease. So, omega-3 fatty acids, basically it's an anti-inflammatory. So, it decreases blood pressure and it decreases the amount of triglycerides, which will in turn reduce inflammation. It also lowers blood pressure, and that's because there will be a reduced amount of inflammation in the heart and even in the brain. So there'll be better cognitive functions, and there will be less blood clotting. Blood clotting is a huge risk factor for cardiovascular disease and having a heart attack. So, omega 3 fatty acids is a go to medication and supplement that doctors use to really help and prevent cardiovascular disease. And lastly, prevention. So there's many ways to prevent cardiovascular disease. For instance, control your blood pressure. High blood pressure is not good. You really want to increase your HDLs and lower your LDLs. You also want to lower your cholesterol. That is very important. And you really want to be careful if you're diabetic or prevent diabetes as a whole by controlling your insulin levels, eating a low-fat diet with little salt. That can help. Also, you want to exercise predominantly 30 minutes a day. That helps a lot. And also, you want to decrease your stress level. A lot of people don't know that stress is a contributor to heart disease. So, thank you so much for listening. I hope you enjoyed my lecture.